Today we'll be looking at how to measure somebody's blood pressure. A blood pressure has two measurements. It has a top and a bottom number. The top is your systolic blood pressure and the bottom is your diastolic blood pressure. Some things that you will need is obviously the person who needs their blood pressure tested. You're gonna need a blood pressure cuff and you're gonna need a stethoscope. Alright, so how to put the blood pressure cuff on. There's usually an arrow, or in this case it says artery with an arrow, that you can put on the inside of the person's arm. And then you wrap this around and it velcros onto the person's arm. And then you put this, there should be loops right here for the dial, and then there's a little clip, so you can do that, or you can just clip it to the patient's arm or hold it or have them hold it. And then you're gonna hold the pump in one hand, and then you put your stethoscope on with the ears pointing up, so towards your nose. And then when you're measuring, you place the stethoscope on the inside of their arm, and then you have your other hand pumping while you're reading the measurement.
We are now ready to take the actual blood pressure. The two numbers we are looking for is the systolic blood pressure and diastolic blood pressure. So as you can see, that needle is going up to about 200 millimeters per mercury and will go down as I release air. The first heartbeat you hear from the patient's arm is your systolic blood pressure. This is the pressure it takes to pump blood to the body. As you keep going and releasing air, the needle will keep going down. As soon as you will no longer hear the patient's heartbeat, that's your diastolic blood pressure. That is the pressure left in the heart after blood is released. Those are the two numbers that we are looking for. The systolic is on the top of the blood pressure reading, and the diastolic is on the bottom. So as you see, that needle is keep going all the way to the bottom, and as soon as we have our two numbers, we're going to release air all the way out so the cuff is no longer squeezing the patient's arm, and that completes the blood pressure reading.